Hi everybody, welcome back. I've been waiting for you. I've got lots of stuff to tell. This is really, really important. Quick review. We talked about what Medicare is. You have to be 65. We talked about the fact that Medicare certainly does not pay all the medical bills we have to pay on a regular basis. We've talked about the need, the gap between the bill and the insurance coverage. The need for Medigap insurance is to fill in the gaps of coverage on what in fact Medicare won't pay for. In this short video, I'm going to show you how you can save money and get something that you don't have with Medicare. Something that was critically important to me and my family when I was diagnosed with cancer a little more than 3 years ago. I'm talking about supplemental Medicare insurance, otherwise known as what we're talking about, Medigap. And we're going to talk in this short series of why it's important and how to get the right one for you and your family. And how do we make the search for the right policy at the right price much easier for you. Finding the right policy at the right price and not taking 100 hours of homework. There are so many different policies with so many different pieces, it's almost impossible for the layperson to compare them. Even me, I can't do it. But Weiss has done it for you. We're talking the Weiss Medigap report. The need and the plan to meet the need. That's the Weiss Medigap report. My name is on this one, and I'm proud it is. But why Weiss? Why should I trust them? I've been involved in the financial services business over 40 years. Years ago, when my wife and I started radio, we were looking for somebody, this goes back 25 years. We were looking for a company that had unbiased, for our listeners, we were on 200 radio stations and on CNBC and TV. We tried to find somebody, a company, that would rate the safety of banks and financial institutions and had generally trustworthy information. We looked and looked and looked and looked. And we finally found Martin Weiss and Weiss Research. The Weiss report comes with Weiss ratings for every company. The phone number. And you can call to contact them. The exact number to call. We don't care where you buy the insurance. Buy it from an insurance company highly rated by Weiss ratings. We're here to make sure that you buy the right one for you at the right price with the kinds of things that you need. If you make the wrong choices, you'll almost definitely get ripped off. I have an example here. Brace yourself. I got a bunch of examples. I'm going to give you one. And believe me, this is not an extreme one. I'm going to read it word for word. Consider a 65-year-old woman living in Utah. She wants to buy a simple, basic Medigap Plan A. But her agent gives her a quote for a particular insurance company, and she practically faints. They want $2,591 per year. She decides instead to go with an HMO, which Medicare Advantage, which seems to be cheaper. Well, that's really too bad. We talked about freedom of choice because at HMO, she loses her freedom of choice. She can't go to her favorite hand-picked doctors. Her quality of care becomes inferior. Her health, already fragile, ultimately suffers. What's especially sad is that her agent fails to do one simple thing. He fails to tell her about the cheapest insurer in his area for her age and for the plan she needs. Right now, as I write you this letter, XYZ Company offers the same plan with the exact same benefits for $819 per year if she had only known. This is just one of 3,500 abuses where people paid too much. Paying too much for the right policy is bad enough. Paying too much for the wrong policy is even worse. Not an exception, not an email because I needed it to talk to you today. One of a stack. $49. This is not extreme. I got a bunch of these, and don't let it happen to you, and don't get ripped off. When somebody offers me something that appears to be really good, that's going to save me time, it's going to save me money, it's going to protect my family, it's going to protect me from the kinds of surprise I had, the $200,000 cancer treatment, yeah, $49, that seems inexpensive for what I can save in care and premiums. But who's offering it? The Weiss Report. A lot of work went into this. Worth every penny. You can have your customized Medigap report in your hands in the next 20 minutes. We'll give you the Weiss rating for each company in your report. The Weiss rating, its safety rating. The best down. You can deal with only the safest, most reliable health insurers. Okay, safety, safety, safety. And savings. A complete list of nearly all insurance carriers in your area, what they're offering right now. Not last week, not October 2012. What they're offering now, real time, for each Medigap plan based on your personal circumstances, your gender, and listen to this, your zip code. You want to talk personalized? The right policy from the best insurance company at a big saving. You'll save money no matter what. I don't know, it might be a few hundred, it could be a few $100. It could be a few $1,000s, but you're going to save. Big savings we're talking by letting us do the work for you. You might save, I don't know, $300, $400, maybe as much as $5,000. You can't get it from insurance salesmen? I don't think so. Do they want you to compare all the policies and get the best price with the best pieces for you and your family? Some do. Medicare administration doesn't have it. Our old gang, the insurance commissioners, we've worked with them for years. They don't have the information either. Here are the important dates. October 15th, number one, going through December 7th. Remember, after December 7th, you won't get a do-over for another year. If you don't save 5 times the cost of this, when you tell us within 30 days, you're going to get all of the money back. Weiss Medigap report. Order it and order it now. All you have to do is push the button at the bottom of the screen and you'll get the report. 20 minutes. Order now. You're still here. You need a little bit more convincing. I've got lots more convincing to do. All right, we're going to talk more. We'll be right back.